All right, good afternoon, everybody. We'll go ahead and get started. Um, I think what we're going to start first with is the election. And so we have the re-election of our chair and vice chair. And I know that they wanted to say a few words about both last year and the upcoming year. So we'll start with the re-elected chair.
Thank you, Christian. Well, number one, I'm honored to be able to serve as chair again for 2022. Um, I am very proud of all the things that we've accomplished in 2021. We've had a lot of success, whether it's academically, pushing research, focusing on student success. The Next Gen facility was incredible that we got that accomplished this year. And also just being able to work with Dr. Troy. He's done an excellent job. Um, Really invigorating the culture on campus, really pushing the envelope on research. His leadership has been outstanding. So we're just really excited about what we can do in 2022.
Vice chair?
Um, First, I'd like to obviously thank the Board of Curators for nominating and electing me. I'm honored that they have the faith in our leadership abilities, but I'm actually more honored to have served with Daryl. His leadership through very tough times was phenomenal. I know we meet, but Daryl and I talk a lot. We've become good friends. We've agreed, we've disagreed,
That's right.
and it has been an honor to serve with him to help this university go forward. So I'm just honored to serve. Thank you.
We'd also like to talk a little bit about the two most recent accomplishments at the university. I'm going to turn it over to the president for that, about the Next Gen grand opening and Mizzou Forward. Just a few words.
So NextGen is a project that was catalyzed by the board in 2018 when it established it as the most important system priority. And a little over 3 years later, we were able to have the grand opening of the building. But NextGen is much more than a building. It's about the initiatives that will promote research that saves lives in Missouri and beyond. And the work of NextGen began even before the grand opening with the hiring of outstanding faculty. And today we saw the passage of the translational PhD program in biosciences that would attract the very best graduate students from around the world to come to Missouri to pursue their research as well as clinical applications. So we're very excited. And Mizzou Forward is an extension, a dramatic extension of the vision that was established back in 2018 to invest in research and student success at this university using a sustained model that requires new revenues as well as reallocation of existing revenues so that we can support what is most important at the university: research, student success, and engagement. So we're excited about the next 10 years, and I know that the board, led by Curator Chapman and Curator Hobrock, are going to hold all of us accountable so that we can achieve the metrics that we expect of a great research university.
And before we get into questions, thank you, President Choi. Before we get into questions, I do want to address something that has caused a little bit of confusion at the meeting. So we have some points, Cindy, you and I already talked about this, related to the firearm discussion with the collected rules and regs. So we've got some clarification points there, but it is my understanding, and President Choi, correct me if I'm wrong on this, that first of all, we have passed the change to the collected rule. So that amendment did pass. There was a second situation where it was passed where they are asking for additional information about that policy that we now have on the books. But you will see, in terms of a legal situation, we have always been in compliance. There has not been a day that has gone by that the university has not been in compliance with the legal requirements of the state. So what happened, as I understand it, is that the appeals court brought down their decision on September the 1st. And they sent that decision back to the trial court, telling the trial court they needed to issue an order to make it effective. That order has not been made yet. And so this vote today is in anticipation that that order will come. So we remained in compliance because the order has not been issued. And we made the change because we are expecting the order to be issued. Okay? So, and then hopefully these points that I just passed out will just basically restate what I just said. So, is there any other comments about that, or, they have one, they've all got one. They've all got a copy. So, and if not, if we're all good, I think we can open up for questions. Roger, you're center, front and center.
Okay.
You wanna go first?
Well, on the topic of the vaccine mandate, I understand that it will cover most employees. Do you expect anyone to quit over the mandate? And could you clarify when their deadline is to get vaccinated?
So the first question is, do I expect people to quit? There may be some, but when I look at the statistics from our hospital, MU Healthcare, out of the thousands of employees that they only had 4 individuals that decided that they didn't want to seek an exemption, but did not want to get the vaccine. So 4 out of almost 7,000 employees is a very, very small number. But as discussed today with the board, there are going to be exemptions that are provided for medical reasons, religious reasons, and exemptions for those that can be certified to not interact with anyone that works or support federal contracts. So there are many mechanisms to pursue before individuals decide that they want to quit working at the university.
Sydney?
Yeah, so along kind of that same lines, and based on current statistics we have on people who have logged their vaccination status, how many employees do we anticipate being impacted by this protocol?
If we assume that there's about 55% vaccination uploads, I think the number of employees that we have will probably be, including students, probably about 25,000, so maybe another 12,500. But there may be employees as well as student employees that have already been vaccinated that did not upload their vaccination status. So I think the number of those that are vaccinated are higher than what has been recorded in the vaccination upload because it wasn't required. It was voluntary.
Anything else, Cindy, or any other follow-ups on that?
What?
Any other follow-ups on that?
Do we have any anticipations on how many could end up being impacted by those that are exempt?
We don't know. We don't know. But we are going to develop those policies, discuss it with the board, get their input. But we're not going to be developing this in a vacuum. We're going to be discussing it with the faculty, staff, and student employees to get their input as well. And there are best practices that are laid out, I would imagine, at other universities. So we're going to see how other universities were able to implement it. Mm-hmm.
I'm going to go to Emily in the back.
President Moonjoy, I want to ask about possibly some employees losing their job. Let's talk about that aspect of what will the university do? Is there kind of like a 3-strike plan? You know, you've been warned once that you need to get the vaccine. Okay, you've been warned again. 3rd time you're out. What's kind of the plan?
So that will be developed as part of our policy, but we would do all that we can so that we don't have to separate with employees. And I believe the 3 exemptions that we provided, as well as the opportunity for us to segregate those that can be demonstrated not to interact with those that support or work on federal contracts, will actually essentially give 4 opportunities for people that wish to seek those exemptions can. And so I'm focused more on making sure that those policies are going to be efficient and that they'll be fair to our employees.
I have a follow-up to
Sure.
that because I've already actually been reached out to about this. If I'm a student worker and
That's
I'm going to
right.
have to get vaccinated
That's right.
and I live in a dorm,
Mm-hmm.
will my roommate, even though my roommate's not an employee,
Mm-hmm.
will that roommate have to get vaccinated because they're in constant contact?
No.
Why not?
We are currently in the process of complying with the federal vaccine mandate. And the federal vaccine mandate does not require that in that situation for the roommate or the student employee to be vaccinated.
It's
But we
only
do
about-
encourage the student to get vaccinated, right?
It's only about employees. And so those are the folks that are covered. You're talking about the connection
The
between the two?
interaction that we talked about.
Right, but for example, an employee who is covered, their friend, who's not an employee of the university, is not covered by that same mandate.
Got it.
That's the same situation here.
Okay. Thank you.
I'm gonna go to the phone. Alex, do you have a question?
Yeah, I was just wondering, are there going to be options for people to do regular testing if they choose not to get vaccinated? Will that be acceptable?
I don't believe that that is part of the federal vaccine mandate, but we will explore. And I know I know the reason for your question, but the federal vaccine mandate does not, as far as I know, does not allow for testing, those that want to get testing to be opted out of the vaccine.
Anything else, Alex?
No, that's the one thing I had.
Okay.
Where's Alex from?
KOMU.
KOMU, okay.
So do we have any other questions?
Oh, I guess I'm not clear on the guns and vehicles
Mm-hmm.
discussion, what the finance committee would be clearing up. Are we talking about expanding firearms on campus, or I don't see how it can be limited more than it is. But do either of you know?
I'll quickly turn this over to Curator Holbrook. But the committee will explore, whatever they would like to explore. They have 3 weeks to do so. And I'm not sure exactly what they would like to do, but I'm sure as they meet and discuss it, Curator Holbrook will get an idea of what the intent is.
Thank you, Chairman Chapman, for tasking me with this task. I have no idea where it'll go. I'm not going to make I'm not going to try to guess. We will open up the CRRs. We'll see what references are made to them, and we'll see where the curators on the Finance Committee want to do or think they should do. And the results of that discussion will be brought back for the full board to be discussed and make whatever changes the full board at that point in time feels necessary to make.
Oh, and on the deadline for the vaccine, so employees have until January 4th to get their last shot.
To get their last shot so that they have 2 weeks from that date to be fully vaccinated. That's the way we understand it.
I'm going to
Go
follow
ahead.
up real quick about the vaccine mandate. You might know this better than me going to Google, but what about other SEC schools? Are you kind of similar? What are other?
I think we are very similar. Universities, I believe LSU has mandated it. Auburn. There are a few universities that are still waiting to see what their state government will allow them to do. But in our case, the governor came out with a very strong message about providing exemptions to those with medical and religious reasons, and we've incorporated those exemptions into our resolution. But we are not out of step with many universities in the SEC.
I just didn't know if you were concerned maybe about that Christmas break. Maybe some students or employees not returning because of the January 4th deadline.
No, I think our students will. I mean, they love this university. They love all of our universities, and so they will be returning. I am not concerned about that issue.
Thank you.
Cindy, anything else?
Yeah, so for those that they do meet exemption and they choose to receive the twice weekly COVID testings, what's the accessibility of that? Like, will the university be providing those, or?
I don't think that is an option for those for the federal vaccine mandate. Oh, is it?
For those that are, they do meet the exemption, medical, religious, and they get bi-weekly, or twice a week testing.
I think you're confusing that with the
There's actually two
OSHA.
different federal
Okay.
programs. There's OSHA, and then there's federal contractors. They both have the same date, so it's easy to get them confused. But the program for the federal contractors does not have the provision for the testing twice a week. That's for the OSHA, which doesn't apply to the university.
So if they meet the exemption, they won't
They don't have to.
be required to get testing.
Perfect.
Yeah. Maybe one more question, if we have one? Alex, anything from you?
No, I don't.
Okay, all right. Well, I think we're good. Thanks, everybody. Appreciate it.